The patient today is an 80-year-old female who was brought in by ambulance complaining of left hip pain. She's had a history of osteoporosis, previous breast cancer, and right mastectomy. She's been newly diagnosed with bone cancer. We see her today on the med-surg floor with a nurse doing an assessment.
10 critical behaviors prior to every procedure.
My name is Shauna.
Check the physician's order. Wash hands before and after the procedure. Assemble equipment. Identify your client by checking the ID band and/or chart picture, and ask the patient to state his or her name along with date of birth. Introduce yourself to the patient. Provide for privacy and HIPAA confidentiality. Explain the procedure to the patient using developmentally appropriate language and technique. Be sensitive to cultural differences. Use standard precautions at all times. Use proper body mechanics at all times. Refer to the textbook and skills checklist for the steps of the skill you are performing, maintaining safety considerations at all times. Report your abnormal findings to your instructor and the primary nurse assigned to the patient. Document the procedure and the patient's response.
Good morning, Ms. Nelson. How are you feeling?
I'm in a little bit of pain.
Okay, can you go ahead and rate that pain on a scale of 1 to 10, 10 being the worst pain ever?
It's a 9.5.
Okay. And since we gave you that morphine about an hour ago, do you feel like the pain has come down from what it was?
I went from a 12 to 9.5.
Okay, good. Good, making some progress. Okay, I'm just going to go ahead and do a focused physical assessment on Mrs. Nelson, primarily paying attention to the affected limb. We're going to go ahead and check pulses and see if I feel any deformities or whatnot. And I do see that your pulse ox has come up since we put you on the oxygen, so that's always a plus. No trouble breathing?
No.
Okay. I'm going to go ahead and pull these down. Okay. All right, Miss Nelson, you're going to feel me pushing on both of your hips, and I just want you to let me know if you feel any pain. Go ahead and let me know when I do push, okay? So I'm going to push down on both your hips. Okay, you feel the pain on the left side. All right, I'm going to try to be gentle, just pushing. The reason I'm doing this is just to see, basically compare both your hips and see if I feel the same thing. So, and I do feel a gross deformity on her left hip. So, all right, we're going to go ahead and just do your leg. Do you have any pain when I push? No? Now, how did you trip and fall? That's what the paramedics told me.
I've been having pain, but I fell walking my dog.
Okay. I'm going to go ahead and check for pedal pulses. How long were you having that pain before you
It's been about a week.
Okay. All right, so she has positive pedal pulses on both extremities. I'm going to go ahead. Miss Nelson, can you feel me touching the bottom of your foot?
Yes.
Okay. Are you able to wiggle toes on both of your feet? Okay, so I do see that she has limited motor ability on the left foot. She's not able to wiggle her toes as much. Go ahead and just push down gently like it's a gas pedal. Don't go hard though. Okay, and do you feel pain when you push down?
Or just the pain is in my hip.
Okay. All right, so the reason we're doing that is just to test her motor sensory abilities, because if she does have a hip fracture, there's a chance that there was nerve involvement. So we want to go ahead and get a baseline on that. I'm going to cover you back up. Okay. I'm going to go ahead and see what we can do about that pain. I know you did just last get your morphine 1 hour ago, and I know you're on your way to x-ray right now so they can get a definitive look. We'll have confirmation hopefully in about half an hour whether you have a fracture or not. Is there anything else I can get you?
No, thank you.
Okay. Okay, so before Miss Nelson goes down to x-ray, we want to go ahead and get another set of vital signs, make sure that they're all stable. We do want to address her pain because they will be moving her around for the x-ray, so we do want to make sure that's under control. And we would go ahead and double check the labs and make sure everything's good there, address any issues if need be.